We're just waiting for all the Sun Pharma standees to come in. As soon as sufficient number of standees have come in and you've all seen the products advertised, we will then start with the quiz. Please make sure that you've identified the voting pads. They've been stuck to these seats. Anyone who doesn't have a voting pad, please move to a seat nearby which has a voting pad. If you cannot locate a seat with a voting pad, please put your hand up so we can help to escort you. The closer your voting pad is to the gentlemen sitting over here, the faster your message will travel to them. And therefore, if there is a tie in the amount of seconds you've taken, the person who has taken the least amount of seconds with the answer will be declared winner. So it makes more sense to sit in the front rows than in the back rows. Also, please note that if you are two people sitting from the same institution or the same hospital, or even worse, if you are sitting with spouse, both of you will not get prizes like third and second or second and first. We'll choose someone else. So in case you're sitting with spouse, which doesn't normally happen post 3 years of marriage, but if you're still sitting with spouse, please separate for the duration of the quiz. Also, if you're sitting with colleagues or postgraduates from your same college, it makes sense to separate. There have to be minimum 5 standees. There is no number of minimum number of people to sit in the hall, but 5 standees, if they are there, then we will start with the quiz. Can we put the slide? So the rules are fairly simple. You have a voting pad. There will be a timer. There will be an audible timer which is designed to irritate you with sound and disturb your thinking. And there is a visual timer also which will tell you that 15 seconds are getting over. Only after the timer starts, you press the option that is there. Your voting pad, I'm not sure whether it has A, B, C, D or 1, 2, 3, 4. The options here in the question, each question will have 4 options. I think they are labeled 1, 2, 3, 4. And if you remember the sequence of alphabets, A, B, C, D is equal to 1, 2, 3, 4. So no need to press send or link, just press your option. You can change your option any number of times in the 15 seconds. The last option that you pressed will be recorded. And if, as I said, if you are equal, if 2 people have the same marks at the end of the quiz, the person who took the least amount of time to solve it will be adjudged winner. So there is no tie. So if you are clear, if there is anyone not clear with this, then I will tell you in my best Tamil. No? So assumedly everyone is clear with the instructions. And we can start with the warm-up question. And the first question is, which state does Trichy belong to? This is a warm-up question just to get your fingers accustomed to the hardness or softness of the buttons that you will press. So Andhra Pradesh, Kerala, Tamil Nadu or Karnataka, and your time starts now. And this is the auditory stimulus. And that numbers that you see is the ticking away of 15 seconds. So only when you hear this irritating sound or you see the numbers, only then you press. That signals the end of the time that you are allowed. And 93% of you got that, which is great. We'll go to the next question so that at least you're getting used to this. And warm-up question 2, which is, the capital of India is New Delhi, Mumbai, Kolkata or Chennai, and your time starts now. Don't look at the numbers below. That is the number of people answering. And the correct answer, 94%. So we are getting there. There are some easier questions than this in the quiz where we hope that 100% of you will get that right. But if we are we ready to go? Any doubts in anybody's mind? Put your hand up. There are no hands up, so we'll start straight away with the quiz because the quiz master is feeling a little hungry. So the first question, excimer stands for excited dimer. That is how the name came in. What is a dimer? Is it a piezoelectric crystal, argon fluoride gas, metallic dime-shaped disc, or cathode ray? What does dimer stand for? Time starts now. And almost 100 of you did attempt the answer. There is no negative marking, so everyone can attempt. And the correct answer was argon fluoride gas. That is what the word dimer means. We go to the next question. Which of the following about Coats disease is incorrect? Diffuse vascular sheathing is common. Segmental vascular sheathing is common. Abnormal vascular integrity is the cause. And Leber's miliary aneurysms are a mild form of Coats. So 3 of these are correct statements. 1 of them is incorrect. Your time starts now. Many times I give you a clue in the type of answers. I will explain now. And the correct answer is A, diffuse vascular sheathing is common. Now you understand that I've given you diffuse and segmental. Both could not be correct, so the answer, incorrect one would be one of those 2. So I try to help you to the extent possible, short of giving you the actual answer, which by law, section 3, item D, I'm not allowed to give. Scheimpflug cameras evaluate in each scan approximately 120 points, 12,000 points, 1,20,000 points or 1,200 points. And your time starts now. Each time they scan, they evaluate certain number of points. Scheimpflug cameras are for the front of the eye. And the correct answer is 120,000 points. They're expensive cameras, no? So if they're expensive, then only analyzing 1200, it's not value for money. So 120, about 40% of you got that right, or it was evenly spread out. Why would I pay so many lakhs for 1200 points? Question, radiation-induced macular edema can be treated by photodynamic therapy, anti-VEGFs, intravitreal steroids, or all of the above. And your time starts now. Again, to give you a hint, whenever there is all of the above, I'm trying to show off my knowledge that I've researched all this, so it is usually the logical answer to give. And the correct answer is all of the above. So whenever there is a question with all of the above, none of the above, it's the quiz master trying to project his knowledge onto you. I've given you so many options. I've read all this in literature. So go for one of these. Second hint that I'm giving you is whenever there are numbers there, go for the middle numbers, not the outliers. Usually you'll be right. Yeah? I mean, if you're wrong, don't blame the quiz master. And the next question, Ozurdex has a biodegradable copolymer matrix of lactic and pyruvic acid, lactic and glycolic acid, citric and glycolic acid, or citric and pyruvic acid. And your time starts now. Ozurdex is a steroid which they push into the back of the eye. I'm not really sure where the back of the eye is because I'm a corneal surgeon, but it's somewhere at the back. And your correct answer, it was an eeny, meeny, miny, mo. And, but 72% of you got that right, which is great. Lactic and glycolic acid. I would never have known this. And most uveal next Most uveal melanoma patients die due to metastasis in, put a B before rain, it's not in season, liver, kidneys, lungs, or the brain. Okay, so the time starts now. That's brain, not rain. 34% die in the monsoon months, but that is not the question. And the correct answer is the liver, and 55% of you got that right. So it's not the monsoon months. The next question, Lyme disease or Lyme disease is caused by alkali burns, low vitamin C, spirochetes, or a fungal infection. And your time starts now. Lyme disease or Lyme disease. Not sure how to pronounce it, doesn't matter. And hopefully all of you will get this right. So I put in a few easy questions just so that you don't go into depression, and the correct answer is 95%. This is what I was expecting, that this is much better than capital of Delhi. Only 94% got that right. So spirochete causes Lyme disease, and corneal nerve fibers terminate at what level? At the wing cell level, the basal cell level, the Bowman's membrane level, or at the superficial cell level. Superficial stroma level, that should be D, superficial stroma level. So is it wing cell, basal cell, which is at in the epithelium, or just at the Bowman's membrane, or in the superficial stroma? Please forgive that spelling, fourth. And your time starts now. D is superficial stroma. So this is very basic. Where do the nerve fibers terminate? And the correct answer is at the wing cell level. Okay, so it's right at the superficial part of the epithelium, because that's why when you get an abrasion, you get pain. If there was no nerve fiber at the superficial level, if there was an abrasion, they would be painless. So sometimes these are logical also. Very occasionally I use logic for some of the difficult ones like this. And drusen are located below Bruch's membrane, RPE, choroid, or rods and cones, and your time starts now. Drusen, these are those small yellowish dots which the retina people are quite fond of talking about. Where are they located? All these four structures are at the back of the eye. And the correct answer is the RPE, and I'm glad that 2/3 of you got that right. They are located below the RPE level. And the 10th question, in what test do we refer to the Arden ratio? Is it the ERG, VEP, the electronystagmography, or EOG, electrooculography? And your time starts now. Arden ratio. So the and the correct answer is EOG, and again 2/3 of you got that right. There is a light peak upon the dark trough. So the highest peak in the electrooculography, which is done in light and in dark, the light peak upon the dark trough, it is the Arden ratio. So it's about 2 or more than 2, and if it is less than that, then there is some problem with the retina. And can we have the leaderboard? Can we have the scores? So these are the keypads which are so far, some people have actually got 9 out of 10. Of course, this is to tell you that some of those who are leading are those who have bribed me in the past, and we will sort it out as time goes on. We go to the 11th question now. The Menger device is used for long-acting drug delivery into the vitreous, the tear film breakup study, calibration of autoclaves, or it's part of glaucoma drainage surgery. The Menger device is used for what? And your time starts now. Is it to deliver drugs into the vitreous? Is it one of the newfangled things for glaucoma? Or for calibration of autoclaves? or for TFBUT. And the correct answer is used for TFBUT. Whenever in doubt, remember that I'm a corneal surgeon. I have not much knowledge of autoclaves and things like that. More likely to be a cornea-related answer. And the next question is propramidine. Propramidine is used for the treatment of acanthamoeba, fungal infections, diabetes, or glaucoma. And your time starts now. And the correct answer is acanthamoeba keratitis. And 91% of you got that right. That's wonderful. For those who've just joined in late, just pick up a voting pad which is lying on the seat with you and you can participate. There are still approximately 38 odd questions and you could still be the winner because the current people who are sitting here haven't done too well so far. We'll go to the next question. Glycosaminoglycans or GAGs with units of N-acetyl glucosamine is descriptive of HPMC, chondroitin sulfate, sodium hyaluronate or CMC, carboxymethyl cellulose. So this chemical structure describes what? And your time starts now. So GAG with NAG combination. I just wanted to show off that I know the full form, so I put it there. And it is, the correct answer is sodium hyaluronate. And unfortunately, many of you all like chondroitin sulfate. Sodium hyaluronate has been around for quite some time now. And it has repeated units of GAGs with units of N-acetyl glucosamine. Next, scintillography is a test used to diagnose disorders of the blood aqueous barrier or for retinal blood flow or ocular surface or the lacrimal drainage system. And your time starts now. Scintillography is commonly used for which of these? For diagnostic purposes. And hopefully most of you get this right. It's the, yes, 77% of you got that right. It's technetium 199. You put a drop of it and then allow it to flow through the lacrimal passage. And the radiologist gets bored because he's taking pictures every 10 minutes or so. And he sees whether it's passing through. So it's used for design for when you do not like to do sac syringing because it costs no money and you want the patient to spend money, you send him for scintillography. Amblyopia is most likely to occur in accommodative esotropia, in Duane's retraction syndrome, intermittent exotropia, or in constant exotropia. Most likely to occur, amblyopia. Your time starts now. In which of these conditions? You will assume that the patient will get amblyopia. Duane's is the classical Duane's, type 1. And the correct answer is accommodative esotropia. Only 1/3 of you people are reading up on amblyopia treatment. 60% thought it was constant exotropia. It doesn't happen like that. We'll go to the next question. One more. In the primary position, the primary action of superior oblique. So primary position means patient looking straight ahead. The superior oblique is an elevator, depressor, intorter or extorter, and your time starts now. Primary position, remember that is important to the question. And the correct answer is it's an intorter. It intorts and 75% of you got that right. I think we are okay with our squints overall, so we'll move on to some other specialty. VKH patients, this stands for Vogt-Koyanagi-Harada syndrome. This is to impress you. They have increased HLA B27, B22, B2 or B5 and your time starts now. The VKH patients. They have a gray forelock. They have panuveitis. And which of these tests would you ask for? And the correct answer is HLA-B22. The poor HLA-B27 is the one which is blamed for so many things. Unfortunately, not in VKH. So in VKH, it is HLA-B22. The highest percentage of goblet cells in the conjunctiva is in the upper nasal, lower temporal, lower nasal or upper temporal fornix. In this, you need to silently toss a coin in your head, and the time starts now. It has to be one of these four. We've pretty much covered the whole ocular surface. I'm presuming we'll get a... And the correct answer is the lower nasal fornix. And surprisingly, 38% thought it is the lower nasal fornix. That's good coin tossing. Next stop, Las Vegas. In status migrainous headache, status migrainous, like status asthmaticus, somebody is constantly in asthma, status migrainous headache. You call it status migrainous if the headache lasts over 48 hours, 72 hours, 24 hours or 96 hours, and your time starts now. So occasional headache, 4-5 hours, we say he's got migraine. But to call it status migrainous, it should last for a particular time. And the correct answer is it should last for 72 hours. And well divided between 72 and 48 hours. So again, it's usually somewhere in the middle, as I told you, never the outliers. So those who listen to me on that have benefited. 10% of your prize money has to be donated to the quiz master. 20th question, which of these is not present in lactated Ringer's solution? Magnesium chloride, calcium chloride, sodium lactate or potassium chloride. 3 of these are present in lactated Ringer's solution, and your time starts now. What we commonly call Ringer's lactate, technically it's called lactated Ringer's. And the correct answer is magnesium chloride, and it was well divided between the groups. You all assume that because lactate is there, lactate is bound to be present, which is correct. So magnesium chloride is not present. Magnesium is quite toxic. Incidentally, can we have the leaderboard? So after 20 questions, we are 2/5 of the way, and we have now come down to 15s and 14s. So we've got still time for you others to catch up. We'll go on to the next 21st question. The normal levels of angiotensin converting enzyme is less than 0.35, less than 350, less than 35 or less than 3.5. So don't ask for ACE test, patient has to pay for it. But if you do, you should have some idea of what is normal. And your time starts now. So I've given you a pretty broad grouping. So it's closest to which of these? And the correct answer is less than 35 would be considered normal. Of course, everything is less than 350, but normal is less than 35, around 20 or so is all right. If it goes above this, then you would consider it as abnormal. So don't ask for a test in which you're not very sure of what you expect, unless you have a pathologist who's your first cousin from the mother's side. The second question is, the next one is 22nd question. The drop in heart rate is commonest while pulling on which extraocular muscle in squint surgery? So if your anesthetist is standing by, he tells you, stop doctor, the heart rate is going down. Likely to occur in which of these 4 muscles out of 6 that I've given you? Your time starts now. Medial rectus, lateral rectus, inferior oblique or superior oblique? Which of these would cause a drop in heart rate, most likely. And the correct answer is the medial rectus, and 60% of you got that right. It's the medial rectus. When you tug, you get commonly a drop in heart rate. The next, on ultrasound in choroidal hemangioma, the internal reflectivity will be low, medium, high or absent. If there is a choroidal hemangioma and you ask for an ultrasound, what will be the result? Your time starts now. And the correct answer is that it will be high. So in choroidal, and you got that right, a majority of you got that right, which is good. So high internal reflectivity. If it was going to be absent, why would I do this test? 24, incidence of IPCV, that's the full form, is highest in the British, the Japanese, the Koreans or the Chinese. Again, this is a good toss-up question. So use your coins, virtual coins in your head, cryptocurrency, and toss it and see what you get. Your time starts now. I put this because it's a huge racial difference. And many of the papers came from that particular country because IPCV is so common there. And the correct answer is the Japanese. So 44% of you got that right. It's much more prevalent in Japan than perhaps in Britain, Korea and China put together. So that's the big racial difference which is there. In traumatic hyphema, the maximum chance of a rebleed is in 90 days, 7 to 14 days, 5 to 8 days or 2 to 5 days. And your time starts now. So you're treating a traumatic hyphema with whatever you think, and then suddenly there is a rebleed. This occurs maximum in which period? And the correct answer is not 90 days. Wonderful. It's 2 to 5 days is the time that you get it. You get what is called 90-day glaucoma because of the blood products which are clogging, and so in 90 days you get a glaucoma in these. But the rebleed occurs in 2 to 5 days, evenly spread out in the second, third and fourth options. Duane's type 3 syndrome is characterized by limited adduction, limited abduction, limited adduction and abduction, or no retraction. Which of these is correct about Duane's type 3 syndrome? And your time starts now. Type 3. That shows that I know that there are at least 3 types of Duane's. And the time is over, and it's characterized by limited abduction and abduction both, and I'm glad that a majority of you got that absolutely right. Next, what is the temperature produced at the ciliary processes in a cyclocryo? Minus 60 to minus 80 is what is produced at the sclera with the cyclocryo. I'm telling you this. So is it the same temperature on the ciliary processes, or is it the minus 30 to 49, or is it 0 degrees, or is it minus 10? Your time starts now. So when you do a cyclocryo to reduce the eye pressure, 2 to 3 millimeters behind the limbus over the ciliary body, at the ciliary processes, what is happening? And the correct answer is it's minus 10 degrees at the ciliary processes, and only about a quarter of you got that right. Which of these persons has not been the president of the AIOS? Dr. Tahira Agarwal, Dr. Jaivir Agarwal, Dr. C.P. Gupta and Dr. Babu Rajendran. These are all legends from Tamil Nadu. Some of you were not born when some of them were president, but that doesn't matter. You should know about your presidents, and your time starts now. One of these people have not been AIOS president. For the youngsters, again toss that same cryptocurrency coin. But I hope a majority of you will get this right. And the correct answer is Dr. Tahira Agarwal has not been. Dr. Jaivir Agarwal and Tahira Agarwal were Amar's parents. Both could not be president. There has been only one, in the history of AIS, only one pair who are relatives of each other who have been president. That's one Dr. B.T. Maskati and Dr. Quresh Maskati. No other relatives have done that because nepotism is not common in AIOS. So Dr. Jaivir, Dr. C.P. Gupta and Dr. Babu Rajendran have been presidents. And the next question is on brimonidine. Brimonidine is an alpha 1 and 2 antagonist or an alpha 1 and 2 agonist or only an alpha 2 antagonist or only an alpha 2 agonist. And your time starts now. This is an anti-glaucoma drug. For those who are only doing retina work and things, this is one of those drugs for glaucoma. And it has to be one of these. So it's an alpha 2 agonist, and a majority of you got that right. That's wonderful. And the 30th question, which meibomian gland disease is most common? Is it obstructive, hypersecretory, hyposecretory or seborrheic? These are different types of meibomian gland disease. Again, to show you that I'm a corneal surgeon and I know so much, and your time starts now. Which of these is the most common? The answer here, if you use logic, you might get it. And hopefully 95% will get this right. And the correct answer is obstructive, only 52%. Please understand that all these companies which make these hot compresses and warm compresses and IPLs and things like that which cost money, LipiFlow, all of them work on heat. It would not, if the glands were not obstructed, there's no point in opening them. So it has to be obstructive. So only half of you thought it was obstructive. The other half needs to be educated by the medical reps so that they can sell their gadgets to you. We'll have the leaderboard on 30. And we are now coming down to 22 questions as the highest. So we are now differentiating a little bit. We'll go to the next question. The Bruckner test or the Bruckner test, there are two dots on the U, but I didn't know how to put them with my limited computer knowledge. So is used for tear evaluation using Placido disc, for squint evaluation, or to diagnose breaks in Bruch's membrane on OCT, or it's a glaucoma provocative test. And your time starts now. Again, hopefully 95% will get this right. I try and slip in these just to make you feel nice and make you forget that lunch is on the horizon. And the correct answer is it's used for squint evaluation, and 70% of you got that right, which is straightforward. You just use the torch and shine it, and depending on whether the torchlight falls, where it falls, we won't go into details. It's used for squint evaluation. Nothing to do with Bruch's membrane. There were actually some people who thought that Bruch's and Bruckner is the same. In ptosis evaluation, the distance between the center of the pupillary light reflex and the upper lid margin with the eye in extreme upgaze is called as margin reflex distance 1, 2, 3 or 4. And your time starts now. Again, for those who have no knowledge of ptosis, choose something in between, usually, not the outliers. Just to help. And the correct answer is MRD3. So if the patient is looking extreme upwards, then the center of the pupillary reflex and the upper lid margin with the patient looking upwards, that's called MRD3. So 66%, 2/3 of you got that right. That's great. In an adult orbit, the volume of the orbit is approximately X times the volume of the eyeball. It's 3 times, 4 times, 5 times or 6 times the volume of the eyeball, our adult orbit. And your time starts now. Orbit has to be bigger than the eyeball, otherwise the eyeball would pop out. So normal non-thyroid orbit, how much bigger is the orbit volume wise? And your correct answer is 4. I told you all, don't go for the extremes, go for the middle numbers. You don't listen to me, I can't help it. I'm trying to help, I'm trying to earn my 10%. You all are not really helping me. And the next question, if a lesion in the orbit is iso-intense on T1 and very hyper-intense on T2, the diagnosis is most likely to be a hematoma, sarcoidosis, metastasis, or a thyroid eye disease. And your time starts now. T1 and T2 are terms used in MRI. So we are not talking about ultrasound or CT scans. And the correct answer is it's in hematoma. And I'm glad that a majority of you got that right. It's in hematoma. It's iso-intense on T1 and hyper-intense on T2. Blood in general is hyper-intense on T2. Which of these is not a 4-mirror gonio lens? The Posner lens, the Sussman lens, the Zeiss lens, or the Kepi lens? Which of these is not a 4-mirror gonio lens? Your time starts now. Take it from me, these are all lenses to evaluate the angle of the eye, gonioscopy. And the correct answer is the Kepi lens, and I'm glad that many of you are actually doing gonioscopies so that you know of the existence of at least these 4 lenses. Tennant, Leisky, Azar, and Hesberg are retinal viewing systems, types of corneal trephines, anterior chamber IOLs, or discoverers of tropical diseases with ocular manifestations. And your time starts now. These 4 gentlemen have lent their names to which of these completely disparate items? Retina, cornea, lens, or tropical diseases? And the answer is anterior chamber IOLs. I am sorry to disappoint you. This was not in your time. This was in my time. I have used these lenses actually. This is about 1 million years ago when and first we had only intracapsular with AC IOLs, and we used these lenses. So it has nothing to do with retinal viewing systems or corneal trephines. And in white without pressure or white with pressure, the peripheral retinal thickness is decreased, increased, markedly increased, or markedly decreased. And your time starts now. When you see a patient with an indirect ophthalmoscopy and you see white with pressure or white without pressure in the periphery, if you were to actually measure the thickness, it would be increased, right? Not markedly increased or decreased, because then it would be like a tumor there or absent retina there, so it would not be markedly. So logic says that it would be either decreased or increased, and you could be 50% right if you've chosen A or B. Next, what is an erisophake? It's blood staining of the crystalline lens, blood staining of an IOL, instrument used for intracapsular cataract extraction, or instrument used for femtocataract surgery. And your time starts now. Erisophake. And the correct answer is an instrument used for intracapsular cataract extraction. 1/3 of you got that right. It was like an old ink filler. You just pressed a balloon at the back, and it was a cup which sat over there, created a vacuum between the cup and the cataract capsule, and you pulled out. And if it was a mature cataract, which is you only operated mature cataracts intracapsular, the whole cataract would come out. If it was immature cataract, only the capsule would come out, leaving the whole lens behind, and your boss would fire you. value of the Shermer's test with anesthesia divided by tear clearance rate is called the DTS index, that's dysfunctional tear syndrome index, OSD index, that's ocular surface disease index, lacrimal efficiency index, or tear function index. And your time starts now. This ratio, no longer used now with all the modern machines which have come, which show you myographies and tear meniscus heights and things like that. But we used to do this. So you can do an eeny, meeny, miny, mo. And the correct answer would be tear function index. So you did do an evenly divided. The extreme that side was for A and so on. Lipofuscin granules accumulate in age-related macular degeneration in which part of the retinal pigment epithelial cells? In the lysosomes, in the nuclei, in the cell wall, or in the mitochondria? And your time starts now. So these degenerative granules, lipofuscin, they accumulate in some part of the RPE cells. And these are the only 4 parts that I know of in a cell. So I put all 4 for you. And the correct answer is they accumulate in the lysosomes. And 60% of you got that right, that they do accumulate there. Can we have the leaderboard? So we are fairly stuck at 29, 25, 24. So we are separating. Imagine those who are tied. If you were sitting in the front, it would have been faster and you will get more points. We go to the next, the penultimate set of questions, the last 10 questions. At birth, the axial length of the eyeball is closer to 15.8, 16.8, 17.8, or 18.6 millimeters. And your time starts now. Then the eyeball grows. We also grow. So the correct answer is 16.8. Again, as I told you, it's somewhere in between. So 50% of you got that right. Which of the following is incorrect about the internal limiting membrane of the retina? Incorrect. It's 2.5 microns thick. It's a multilaminar membrane. It's derived from the vitreous and it is semi-transparent. One of these is incorrect. 3 of them are correct and your time starts now. The internal limiting membrane and the correct answer, that is the incorrect thing about the internal limiting membrane, is that it's derived from the vitreous. I'm glad that you spread your options, spread your bets there. But the one which is incorrect, it's not derived from the vitreous. It is semi-transparent, it is multilaminar, and it's approximately 2.5 microns thick. He postulated theories of color vision and accommodation and also invented the direct ophthalmoscope. So this busy gentleman who did all these things, was he Hermann von Helmholtz, Franz C. Donders, Ferdinand von Alt, or Jean E. Purkinje? And your time starts now. So he also talked about color vision, accommodation, and invented the direct ophthalmoscope. So this gentleman was von Helmholtz, and I'm glad that most of you know at least about his direct ophthalmoscope. What is not so well known about him is that he also came out with theories of color vision and accommodation, for which others have got credit as well. But basically, von Helmholtz is the brain behind the direct ophthalmoscope. Measles virus can cause acute retinitis and SSPE. What in hell is SSPE? Okay, your time starts now. I'm not reading the answers because they're too complicated. SSPE in connection with the measles virus, what are we referring to? And the correct answer is subacute sclerosing panencephalitis. And almost all of you got this right, which is fantastic. I had no idea of this till I started reading about it. And I'm amazed that you got this right. We'll try capital of Delhi again after some time. Azathioprine used in uveitis is an anti-metabolite, calcineurin inhibitor, T-cell inhibitor, or an alkylating agent. Which of these is correct? Your time starts now. Azathioprine. We use several drugs for uveitis, severe uveitis. Azathioprine, chlorambucil, cyclophosphamide, mycophenolate, mofetil. And azathioprine, which is commonly used, is an anti-metabolite, and the jury is evenly out on these, but it's an anti-metabolite. Which of the following is true about retinitis pigmentosa? High doses of vitamin B complex is recommended, is usually a single gene disorder. In India, the prevalence is highest in the northeast, or it's either autosomal dominant or X-linked. One of these is true about retinitis pigmentosa, the others are false. Which of them is true? And your time starts now. A lot of research has gone into retinitis pigmentosa. And the correct answer is it's usually a single gene disorder. Obviously, high doses of B complex are not recommended, otherwise you would have it mushrooming everywhere. And a lot of genetic studies are taking place, and it's usually a single gene disorder. The current AIOS president is Dr. S. Natarajan, Dr. Mahipal Sachdev, Dr. Lalit Verma, or Harbans Lal. So I talked to you about the past. Now let's talk about the present. You do know that there is an institution called AIOS. Time starts now. AIOS stands for All India Ophthalmological Society. We recommend that you become a member so that you know who your president is. And the current president happens to be Dr. Harbans Lal. And I'm amazed. I need this to be photographed, please, and sent to the AIS office. The last conference was in Cochin, where this particular gentleman who hails from Delhi was sworn in with a lot of pomp and show, and he sincerely believes that everyone in the world knows that he is the president, but only 29% of you know about this. So this gentleman, he is a prolific cataract surgeon. He has contributed a lot. Poor fellow. He will die of shock today. We might have a new president tomorrow. The law stating equal innervations flow to yoke muscles was stated by Gardner, Sherrington, Herring, or Jampolsky. All these fellows are pioneers in squint surgery. And your time starts now. And this very famous law, which states that equal innervation flow to yoke muscles. Yoke muscle means if the lateral rectus of one eye, the medial rectus of the other eye. So the brain sends a command to both of them to look right or left. So this important fact was discovered by one of these four gentlemen, and 76% of you said, yeah, right, that's Herring's law, which is well known. And the penultimate question, 49, second last question coming up. In a normal angle, which is the immediate neighbor of Schwalbe's line, is it the trabecular meshwork, the canal of Schlemm, the iris processes, or the scleral spur? You're all expert at gonioscopy, as we knew the 4-mirror lens. You answered correctly. Hopefully you'll get this right. And your time starts now. Immediate neighbor of Schwalbe's line. Our immediate neighbor of the McMahon line is Pakistan. Schwalbe's line. And the correct answer is the trabecular meshwork. So 73% of you got that right. And for the final question in this round, high altitude retinopathy. If you're stupid enough to go to Mount Everest and climb to the top, then you might get deep retinal hemorrhages and vasodilatation, or superficial retinal hemorrhages and vasodilatation, or deep retinal hemorrhages and vasoconstriction. or superficial retinal hemorrhages and vasoconstriction. And your time starts now. So I would not recommend going to Mount Everest for anyone because you'd get at least one of these four, which is quite scary. You might also die of frostbite or fall off in an avalanche. And the correct answer is superficial retinal hemorrhages and vasodilatation, and it was evenly spread out in the second, third, and fourth. And with that, we come to the end of the quiz. Can we have the leaderboard? Yeah, give you a minute. Can I invite members of Sun Pharma who put up the standees to please come up? Somebody from Sun Pharma? Can we have Dr. Vaishnavi? I believe there are prizes. They are to be given to the quiz master, and if any left over, then we give it to the top three winners. Yeah? We are just tabulating the results. I thank Sun Pharma for sponsoring the event and the prizes. And I thank Dr. Vaishnavi for all her help, and the audiovisual team of Mr. Julius for putting it all together so flawlessly. I thank all of you for being a patient audience, and if you're still here to cheer the three winners, then we'll go for lunch together after this. So we start with what are the prizes? Come up. So Dr. Vaishnavi to announce the prizes. Ready? Okay. So the third prize winner is Keypad 81. Can Keypad 81 come up, please? Tell us what is your name and where are you from?
I am Dr. Subita. I am doing my DNB residency in Southern Railway Hospital, Chennai.
Congratulations, Dr. Subita. Thank you. Stay there. Yeah. And the second prize is keypad number. In due course, it will. Yes, keypad number 49. Congratulations. And what is your name and where are you from?
I am Muthu Krishnan. I am from Aravind Hospital, Madurai.
Congratulations, Muthu. Just stay on that side. And our grand prize winner for the first prize is keypad number 97. Wonderful. Congratulations. And tell us.
I'm Dr. Aparna KS. I'm doing a fellowship in orbit and oculoplasty at Aravind Eye Hospital, Tirunelveli.
Congratulations, and can we have all of you for a group photo? Dr. Vaishnavi also come. Somebody from Sun Pharma, please come. Can I return the mic?
addiction. Only Brimal addiction.
அவங்க இருக்கிறது தப்பா இருக்குல்ல. சரி சரி அனுப்பிச்சிடாத கம்பெனிக்கு. முத்து சார் எடுத்துடலாம் ஸ்டாண்டியா? இல்லை அவங்க சொல்லி எடுத்து நல்லா இருக்காது.
அதான் நானும் சொல்லிக்கிறேன், எடுத்துடலாம், வேலை முடிஞ்சு.
அது ஒன்று மட்டும் இருக்கட்டும்.
தம்பி
யாரும் என்ன இருக்குங்களோ வச்சுருப்பாங்க.
எது இல்லைப்பா, ஒரு சரண பஸ் இருக்கு.
ப்ராடக்ட்டை போட்டு இதில் இது Sebastian.
MPP is not there, I don't know who's going to speak.
நாளைக்கு ஆக்சுவலி சென்னை வந்துட்டு
So, good afternoon, one and all.